Hello, everyone. Welcome to our QGIS India user group monthly meeting. Hope everybody had good summer break. We didn't meet last month since many of us were traveling, but hope everybody's back and had a good vacation. Today we have some updates. We have Vijay Kumar with us who's going to share a nice case study and present his work on that. And we have some new updates for our website and content. So I'll start with that and then we'll do Q&A. We have some topics that have been thinking about to discuss with the group. So we'll go through that. The group has been growing. Our QGIS India user group is essentially an online community. It's open to everybody. LinkedIn is our biggest community. We have 1,000 members or so. Telegram was our main communication channel. Unfortunately, this week it's blocked in India due to the NEET exams. And I think this also, I've been hearing from many people that Telegram is not the best fit for them. They don't check it often and they miss a lot of updates. So maybe we should discuss whether we should move to WhatsApp as our communication channel. And I've been part of some other groups with the WhatsApp communities, and I think that also works quite well. So maybe we can discuss it afterwards. But the email group has also been growing. We have a YouTube channel where we are posting all the recordings. And again, if you've not joined any of those channels, go to the website and you can join those channels. In case you want to help with the user group and help any of the aspects of running the user group, you can just email and we'll contact you and loop you in. I want to share updates on the member directory. This was set up a few months back, and the idea for this was because we are an online community, we don't really know who forms this user group. If somebody says, hey, I want to meet other QGIS users in my city, how do I find them? Also, there are companies who say, hey, I want to hire somebody in the city, or I'm looking for companies in this region which have expertise in QGIS. We didn't really know all of that, so we thought we'll set up a directory. We have a form that you can register. Again, it's an open form. You can go and submit your information. You can choose not to be listed publicly. Just say submit information so the group itself knows about you, but we don't publish it on the website. But if you want to be listed on the website, there's an option for that as well. And we have made this directory on the web page. It's great for networking, so you can find other people in your city if you want to host a local meetup or just know what are the other organizations who are using QGIS. So I just want to quickly show you that page on the website. So this is the website on in.qgis.org. We have the member directory page here, and here we have 62 people registered so far. And again, there are 1,000 people in LinkedIn group. So there are many people who have not yet submitted the form. Please do so. I think it's great for you to network with each other. We've added the LinkedIn profiles as well. So again, this again helps companies to discover who you are and for people to connect with each other if you wanted to. And again, it's a searchable directory with cities and organizations. So do check this out. It's on the website and you can fill the form. We also have lots of content published on the website. This is another opportunity for you to share your expertise. The website is hosted on qgis.org, very high visibility. If you have expertise, if your organization works on some interesting, cool projects, and if you want to share that, it's a platform for you to showcase that. Even if it's an individual, if you write some cool tutorial or you have discovered a workflow, you can share that. We have an amazing team of content reviewers who will help you format the content and make it better. So if you're looking for some peer feedback and peer reviews and also a place to host your content, do check out all the content and submit new content. We're always on the lookout for new content. We'll help you structure it and then you can publish it on the website. Just yesterday, or maybe 2 days back, we published a new blog post by Jyoti. This is an amazing blog post on how to use QGIS for storytelling, some great visuals, and how to use QGIS to tell interesting stories. We have Jyoti with us. Jyoti, why don't you share more about this blog post you wrote and share about the content there?
Yeah, of course. Thank you, Ajal. I will take just a couple of minutes to take the folks through the blog that was recently published. So a little bit of background. My screen is visible, right?
Yes.
Okay, great. So I am a geospatial analyst at WRI India, working as a senior program associate, and we use QGIS and open source tools to kind of, do these social media posts where we raise awareness on a certain problem statement, or we use the means of social media by sharing more about our publications or any working paper or our work on ground. So this is a blog to share how we use QGIS in that process, in that whole process, how we start, how the conversations start, and how different components of our uh, processes kind of fall together in this entire initiative of social media awareness. So we start by finding the narrative. What exactly do we want to do with that social media post? What is it that we want to share? Which study do we want to correlate, or which of our any of our work that is recently published or has been out there for government officials to look at, or turn into policy decisions or discussions. So all of that, we kind of start with forming the narrative, uh, taking taking into account the study or the paper that has recently been published from our end. And then we rely heavily on open source data, which I've already mentioned in the blog, and what kind of data sets we look into, and how we devise the narrative around the availability of data sets and the end goal of the social media post. So, gave this example of Tamil Nadu, where we wanted to talk about the migration, or just the destinations that are favored for work-related opportunities in Tamil Nadu. So this was part of the entire of a bigger narrative for World Habitat Day in 2023. And then this was the most recent one on air quality that we worked on. So the narrative here was that we wanted to focus on the air quality of tier 2 cities like Gorakhpur. So Gorakhpur was the main concern in the study. So that's how we kind of formed the entire narrative around this social media post. Similarly, there are other examples like here, talking about the urban heat island effect in 4 major cities, and the color palettes. How are we choosing the color palettes or shapes, or the outlines of various cities? So this is one of the examples. Then this is another example where I am talking about how we have chosen a dark background to show the night lights, changing night lights of growing. This is kind of visually showing how the cities have grown over time. And this was part of International Day of Light for one of the years, I think in 2023 itself, 2022 or 23. Oh, okay, this is 24. And then how do we decide the labels? How do we decide the shapes and symbols? All of that we have talked about in this blog, giving examples. So, for example, this is another post for International Day of Light 2025, where we have used circles as shapes to show to correlate the number of jobs with growing cities, like growing cities in the NCR region, the NCR states, basically. Then we cannot show everything all at once. So this segment where we are talking about the art of letting go, we are talking about how we prioritize certain elements over others. So for example, this where we are talking about the built-up growth in flood-prone areas of Kashmir Valley, we have taken a small section of the DEM and just shown the Kashmir Valley with very subtle colors. This is the boundary and of the metropolitan region of Srinagar, and with very subtle boundary that this should not overshadow the main idea of the blog or of the social media post, of the idea or the narrative that you want to show. So this is focusing on how the built up growth has taken place over the flood extent that we mapped using 2004 2014 flood extent in Kashmir Valley. Then just the conclusion and final touch on how how all of these things come together. And this is just a little bit about me and people who have contributed to this blog. So that's it from my end. Thank you.
Yeah, thanks, Jyoti. I think this was really cool. I was always been a big fan of all the work that WRI puts out on social media. And one of the things I always tell people that in the age of social media and now with AI, the most important skill that all of us should develop is storytelling. Because without that, you won't get people's attention. So I think most of us are so focused on the technical aspects and doing the analysis, but not paying enough attention to storytelling and visualization. And I like that we have a blog post with all the best practices that you have written down and shared so that we can just point people to one place instead of saying, hey, go and look at this Twitter account or go and look at this LinkedIn post. So thanks for sharing. And I know you put in a lot of effort in curating all of those content. So thanks for sharing that.
Thank you.
We also have a new case study published by Dr. Vijay Kumar on using network analysis and applying this to healthcare in QGIS. If you want to know more, you can go and read the case study on the website. But we have Vijay Kumar here who's going to talk about it. For our next feature presentation, we have Dr. Vijay Kumar, who's going to talk about spatial accessibility of public healthcare facilities using QGIS, and he's going to share his case study and how he made it happen. So over to you, Vijay Kumar.
Yeah, thank you so much, Ujjwal, and also the QGIS India platform for giving me this opportunity and publish my study in QGIS such as a wonderful platform. So I'm sharing my screen. So is my screen visible?
Yes.
Okay, okay.
Perfect. Yes.
Okay. So let's we start. First of all, good evening to everyone, and those who are present here or those who are not able to present, they can so from the YouTube or whatever. So basically, my name is Dr. Vijay, and I'm working as assistant professor in Department of Economics in Manipal University, Jaipur. And basically, this is case study is I try to present today in specifically for the spatial accessibility of the public healthcare facility using the QGIS. It has been published in QGIS already. I mentioned in the Indian user groups website, and basically this study is tells about that the interaction between the economics and the public health and the open source such as that QGIS tells about the geospatial technology and how that technology is involved in that and how that is beneficial for the policy making. And basically my goal today is to show that you just note what we found, but how we found it entirely using the QGIS tool, which is freely and open source. And basically this study is the tribal district, that is the Banaskata district in northern Gujarat. This is semi-arid and rural districts also. Basically, the peoples are accessing healthcare depending on where they have living. And those who are living in the central Banaskata, they are able to access healthcare facility in easy way. But those who are living in the periphery area, they are able to access in difficulty. So after the end of the presentation, we try to try to finish in that, or the we leave from the clear sense of how QGIS can be genuinely policy tool, not just and not just for that as a tool or the academic tool. So we will start from the introduction section. Let's we start with the problem. Healthcare access is the fundamental rule, or those who are living in that rural area or the remote area, they are not able to access the healthcare facility on the time. So a lot of the healthcare facility or the infrastructure is developed by government or the private agencies, but they are looking in that which location is the preferred. So we can easily using the QGIS we can solve that the problem. Lot of the issues in that those who are living in that area in the center, they are able to access healthcare facility, or those who are living in the near to the healthcare facility such as the tertiary or the primary or the secondary, they can easily access the healthcare facility. But those who are living in the far from the healthcare facility, such as that 10 kilometer, 15 kilometer, or whatever the 19 kilometer, or that 60 kilometer away, they are not able to reach on the time in the case of the emergency on the referral system. So how that QGIS will play a role here for the establishment of the healthcare facility for the government or the policymakers? So basically, that administrative easily using the QGIS, the administrative or the planning, those who are doing the planning for that establishment of the healthcare facility, they can easily do the head count, administrative head counts, or that the distance from, and that how many persons are living in that particular area, or that the population density also can they see. So all these things will create a false sense of the conversations. So basically, this is where the GIS becomes essential. The GIS allow us to bring the healthcare facility location, road network, population data, and administrative boundaries. It's one of them, and find analytical environment. Also, we have to see the specifically in the terms of the QGIS. This is also freely on the open source and fully replicable. Any district's health department in India, or like outside the India also, can run the analysis without paying the any type of that amount for the software. So WHO also itself in the 2020 guidelines on the measuring the healthcare services explicit the proximity alone does not constitute access. The travel time and the road connectivity, road quality, supply to demand balance must be assessed by together. That's the precisely what this study does. Okay, so in the case study, we have to choose the Banaskanta district. This is the tribal district from the northern Gujarat. And in that is we have to see, as per the government data, public healthcare facility. One is the district hospital in the Palanpur, and the CHC, and that PSC and the subcenters. So there is the square 12,703 square kilometer is the area total, and the population and the taluka and everything is mentioned in the PPT. And here the NS27 provides a rapid access of the northern corridor to eastern corridor for the road connectivity and all these things. The healthcare infrastructure also shows that districts analytical interesting. The policy relevant is the expert extraordinary variation in the conditions across the talukas. In the semi-arid landscape, low rates of the private vehicles owners and the infrastructure public transport also. And we have also seen that the situation where the geographical location is powerfully determined, wherever or not someone can access the healthcare facility, how they have to reach those who are not able to access the transportation, and they have also not connected with the road, good quality of the roads or the road connectivity. They are also facing a lot of the problems in that. So where the conversion administrative data is insufficient, where the spatial analysis add the critical value. So our objective is that they map the analysis spatial distributed of healthcare facilities across the Banaskanta district using the QGIS, and assess the geographic coverage of the using the buffer zone of the 10 kilometer of the 50 kilometer, using the service threshold and all these things. And also try to evaluate the real world accessibility through the network based analysis using the distance and the travel time modeling. And also try to realistic the service catchment area using the two-step floating catchment area in the 30 or the 60 minutes of the travel time. Also integrate to the population demand using the two-step floating catchment area method to produce the composite index in that. So basically, on the basis of the research objective, we have to capture the research questions: where the public healthcare facility located and how they are distributed across talukas in the Banaskanta district. And question second is that the which settlement falls outside standard services catchment threshold. And another third question is that what are the actual travel time from the village to the nearest healthcare facility using the road networks. And last one is that the does supply meet demand, or are some facilities overburdened relatively to the population served. areas. So basically, we have to use the data from the different sources. That data is also from the open source, and we have to use the healthcare facilities from the NHM, and the village population data from the census 2011, and road connectivity from the, and that is also in in that plugin QGIS already available. Open street map and the administrative boundaries from the Survey of India. So, from the methodological perspective, we have to use the different types of that the categorization of the every objective. Firstly, we have to coordinate the geospatial located all the healthcare facility and import the facility coordinates into the QGIS, and after then the so the distribution of the healthcare facilities such as the UHC, CHC, subcenter, district hospitals, and all administrative boundaries and the road networks. And in the second one, we have to do the buffer analysis. How much they have to, for example, without the road network, how facilities are covering the area in without like in the geographical area, generating that buffer 20 kilometer or the 50 kilometer for the district hospital, or the 20 kilometer for the CHC or the UHC, such as the secondary healthcare facilities, based on the IPHS norms, and identify the settlement outside the service threshold. Or for the network analysis, we have to build that travel speed, such as that for the national highway 60 kilometer per hour, and for the rural area or the rural road for the 20 kilometer or the 40 kilometer per hour, we have to generate, and after then compute the shortest path of the travel time to reach the healthcare facility from the village or the hometown of that patient. Also, we have to do the analysis of the service area using that the iconic. This is also mentioned in that plugin in QGIS. Iconics 30 minutes or 60 minutes of the polygons where the each facilities are available near to the healthcare or near to the household. Unlikely to also, we have to circulate buffer, and these reflects actual road network connectivity or not. After then, the for this last one, last methodology, we have to finalize that the compute the two-step floating catchment area or accessibility index. In that, we have to see the supply to demand ratio per facility within 30 minutes of the catchment. Or the second one is that the sum of the ratio of all facility accessible from the each village to produce composite village level accessibility score. For that analysis perspective, we have to start the mapping. I forget to mention here the map facility mapping of the spatial distribution in the infrastructure. One is the district hospital, and four is the sub district hospital, and 14 per taluka as per the CHC and the UHC. So basically, we have to see in that map, central Palanpur and the Desa host the majority of the healthcare facility, or the clusters of the all health facilities are nearest to the Palanpur on the Desa. And the western and the northeastern talukas such as the Thad, Wow, Danta, they have to minimum a healthcare facility. Those who are living in that particular area, they are not able to easily access the healthcare facility, and there are lot of trouble also facing during that the emergency and the seasons also. Data cleaning, we have to use that the QGIS, and we can also remove the some duplicates or the locations, and we also using the CRS and unified and the coordinates verified from that using the QGIS tool. So for the buffer analysis coverage, the assessment in that, basically we have to do analysis only for that case study, the tertiary healthcare facility or the secondary level of the healthcare facilities. In that, the first map or the first graph is showing here the tertiary health facilities buffer. How they have to reach in near to the Palanpur, lot of the healthcare facilities are available, but in the periphery area they have to very less healthcare facility. We have to see in the map, and the policymakers easily can see that how the facilities are lacking in the particularly periphery area, and they can make the policy for those who are living in the periphery area of Gujarat Gujarat district, Gujarat state, sorry. And for the secondary also, we have to see in that in the center where the Gandhinagar and Ahmedabad, they have to also located lot of the healthcare facility in that. And basically in that good thing is that about every most of the periphery districts like Kutch or that Banaskata, they have to very less healthcare facility as compared to the center where the Gandhinagar and the Surat and those who are the big city. So as per that the theories also, lot of the theories also tell about that the everything is in available, all the facility, all the resources are available in the center where is the state capital is residing. Network analysis, as per the network analysis, we have to found in that network constructs from the national highway. We have to calculate the speed as per the 60 kilometer. For the district or the state road highways, we have to using the 40 kilometers. And the major districts road, there is the quality of the road also categorized according to the quality of the roads also. So in that those who are able to access the healthcare facility within the less than the 50 minutes, they have to good access. And those who are to 15 to 30 minutes, they can like moderate, we have to categorize according to the time. And after then the 30 to 60 minutes, they are limited to access. And but those who are not able to access more than 60 minutes, they are very poor access. I have also published a paper. In that paper in EPW, that paper is also showing here that more than 120 minutes are also there to facing to reach the healthcare facility in the Gujarat and tribal districts. So basically, in the first map, where is the showing the shortest path between the secondary to primary healthcare facility and the secondary to tertiary healthcare facility in the case of the emergency. So we have to see in that the periphery area, they are approximately 116 kilometer. Also, they have to reach from the primary to tertiary healthcare facility, and from the primary to tertiary healthcare secondary to tertiary healthcare facility, they need to cover distance approximately 91 kilometer. This is very far. But in when we will see in that center area, the Gandhinagar or Ahmedabad, they are able to access the facility in easy of way. And second map is also showing here the distribution of the healthcare facility, but in that we have to count here the travel time. So how many lot of the facilities are not able to access the facility within the specific time period, they need to reach more than 100 kilometers. And in this first one is the distance, and second one is showing here the time, travel time. After then, in the last objective, we have to also see here the realistic healthcare is that they able to access or not, and which area is able to access. And if we want to relocate or we want to suggest government or the policymakers to the new healthcare facility using the QGIS tool, that is very easy to show them. So in that the blue area is showing here those who are not able to healthcare facility within the 10 kilometer, or those households or the villages are not able to healthcare facility within the 10 kilometer. In that case of the emergency, they are facing lot of the problems. In the green or the dot area is showing the village center, and the green area is showing here those who are able to access the healthcare facility within the 10 kilometer. And the red dot is showing the healthcare facility of the in that Banaskata district specifically. And the line is showing here the road connectivity in the near to the Palanpur. There is the lot of the roads have the connectivity between that villages and near to the healthcare facility. But in the when we will see in the periphery of the Banaskata, then there is the lacking also in the road connectivity and all these things. So basically, in that we have to find some settlements outside the buffer zone within the 30-minute or the using that the isochronic by direct road. And other is that those who are not able to access the facility within the 10 kilometer or that particular time periods. So in that two-step floating catchment area, we defined the 30-meter travel catchment around that the healthcare facility, and identify all villages within the particular time period. that is we have to use in the 30 minutes or the 60 minutes, and subtotal catchment area using that the pk. So on the basis of that formula, we have to use, see at the total supply of the facility divided by the catchment population. And after then the using that, we have to develop that composite index, that is that sum of the supply to demand is that the ai, already we have to calculate it here, using that total RJ is that the composite ratio, and the, after then the AI is the better accessibility. That means more supply relative to the composite population. But if the AI is lower, then we have to see here. Then we need to establish there is the new healthcare facility as per the map. The outside the area, blue area is showing here that those the blue area is showing here the healthcare facilities are, they need to more, but in the green area they need to not need to the healthcare facility. If we need to relocate, we can also relocate as per the policy. Some healthcare facilities are overlapping, or so we can like relocate these healthcare facilities as per the composite index. So basically, key finding of that this case study is the peripheral taluka or the peripheral villages are underserved. These such as the Salgam, Danta, Wow, these are not able to access the healthcare facility within that specific time period or the specific 10 kilometer or the 20 or 50 kilometer. And after then, we have to also found in that the central overlapping of that healthcare facility in the Palanpur or the Desa, those who are the Banaskata of the center. So that was the reason they are also a lot of the multiple healthcare facilities also they have. And also after then using the buffer zone, we have also found out that accessibility is like overlapping in the center area, but in the periphery area they are lacking. And on the basis of the buffer based, we can also plan the risk missing uh, large unserved population in peripheral zones. Actual travel time also we have to can calculate using the QGIS software. Uh, Network routing reveals the village, those who are more than the 60 minutes from the nearest facility. Those who are buffer would also classify the covered and the road quality and the circuits and primary borderlands also. Also we can also see that using the two-step floating catchment area, they have two peripheral facilities serve population well beyond design capacity. Problem is not just distance, this is also imbalance between the health supply and the rural connectivity and the population density. QGIS freely available software is also we can use that all these things, and we can also easily deliver to the policymaker or the government. So all five analysis completed to in the QGIS, and we can also generate without any cost and replicate by any districts or the states or the whatever we need to for the other country also we can generate using that QGIS. So why this software is very important, and why we need to use QGIS for our analysis? This is very quick. We have some plugin and other plugins. Lot of the plugins also available. This is a Spatial. We can also join. We can also join. We can also do the two-step floating catchment area or other analysis also. Especially we can use the spatial econometrics in that, and CRS management also we can whatever type of the management we need to we can do in that thing. So basically, the policy recommendation or the conclusion of that the case study is the redistribution of the healthcare facility best one, and another one is that they use the QGIS for annual monitoring which facility or the if the population is increasing in specific area, they need to focus on that and make the strategy or the policy according to that. Improve the rural road network or the look the connectivity between the household and the village and a healthcare facility, and address also the supply demand imbalance using the two-step floating catchment area. And another, if the methods are available, we can also use these methods are also, but we need to use the QGIS for the solve these problems. So basically, these are the some limitations of the case study because of the population data from the 2011. This is very gap between that the demography and current time period. Road connectivity, we have to use the OSM data, so that was the reason they have to not cover everything in that, and also the speed limit and all these things are the limitations. And we can see in that future direction use the updated population data, and after then estimate that near to that what type of the problem we need to solve. We can also see that incorporate the real-time road travel data from the Google Map using the API or the GPS logs, and after then we can also extend the two-step floating area to enhance two-step floating catchment area with the distance decay weight of, for more realistic demand modeling, and also add the healthcare facility indicators such as the bed count and doctor ratio and nurse or the manpower or the whatever what type of the facilities or the technologies are available in the healthcare facilities, and also scalable that methodology to the state level or that country level, or we can also see do that for worldwide also using the QGIS. Yeah, thank you so much.
Thanks, Vijay. Uh, any questions from folks? I had a question. So you
Yeah,
mentioned about the limitations of OpenStreetMap data.
yeah.
Have you looked at the GeoSeduct, the PMGSY data that was shared openly a few years ago?
Yeah, I have already see that during my PhD time. I have done my PhD in 2024. That time I also see, but some limitation is, and the some like they have only the national or that the state level road connectivity, but they are not available the local, those who are not state or that national highways. So that was the reason I have not used these data.
Cool. Thanks.
I had one quick question. Dr. Vijay, I saw that you had categorized the roads into rural roads, urban roads, etc. I was just curious to know how was there a separate process followed, or did that classification come with the data itself?
Yeah, that comes when we will use the OSM in the QGIS. When we like extract file from that OSM, then automatically we go to the categorization in that the rural or what, like primary road, secondary road, tertiary road type of that.
Yeah, that's what I remember, like primary, secondary, tertiary road types. Maybe I'll reach out to you separately to
Yeah,
understand
yeah.
what went into rural and what categorization went into urban, sort of. Yeah. Thank you.
Definitely. Yeah.
Yeah, hi, I have a question, Dr. Vijay.
Yes, sir.
So categorizing roads is one thing, but you had any chance or any luck in getting data from the ST networks of India, from the
Yes.
state transport buses, on how the travel times look like?
Okay. I will look that. I have not incorporated these buses, local buses, and all these things, public transportations. But definitely, I will look. Yeah, thank you.
Yeah, I think the road connectivity assumes people have access to a vehicle, but then many people in rural regions may have to rely on public transport, and that will
Definitely, very
increase it
interesting.
even
Yeah, I
more.
will.
Yeah. So this multimodal connectivity requires kind of data with schedules and stuff which is very hard to get in India
Yeah,
because the agencies don't really maintain those. But some kind of estimates and indication, like what we did with speed limits and kind of estimating the travel time, I think it'll be kind of interesting to look at that.
yeah. Definitely, I will look
Actually,
at this. Very interesting.
actually, a good starting point might be just to get the bus ST schedules. They don't run exactly according to the schedules. We know that.
So,
But
can you repeat that source?
no, I mean, just all the state transport buses, they publish a schedule of when they are supposed to leave.
Yeah,
And so I think that's a good starting point. Plus, you can constrain those algorithms with some rules of thumb. some heuristics that might be able to give you, travel times. And rather than focusing on like any of the private transport related things, I think to start off with at least,
Yeah, definitely I will look.
public
We also,
transport would be because
yeah,
a lot of the public healthcare facilities in the rural areas are small. There are only large hospitals in some of the bigger, maybe the class B cities at most. I don't think C cities have very large hospitals and things. So
yeah,
it is quite a decentralized systems when it comes to the smaller ones, and they only handle chronic diseases and not acute diseases. They don't have the
yeah,
equipment to do that. So at least for chronic diseases, the public transport schedule might be a useful start. For acute ones, I think you may have to dice the data a little bit more to get to the hospital facilities, and categorize that may be a little bit.
yeah, definitely. This is very interesting. I will look. Thank you so much. Yeah.
Actually, I did a similar kind of, not similar. For mine is disaster mitigation management. I did a PhD way back in 2024. But it's for Greater Chennai. But I have incorporated both private as well as public entities, hospitals, and I have taken the bed capacity using insurance companies. They used to have a list of hospitals with bed capacity. So, did you have a chance to think along those lines?
Yeah, I have already also think about that. That I try to incorporate the public, private healthcare facilities also, but we have to face the lot of the difficulties for getting the geolocation of the healthcare facilities. But definitely, I am also looking in that era. If I will go to the data or specifically the geolocation of the private healthcare facilities, and after then I will do that thing. I am also
Yeah.
looking in that.
From my experience, the insurance companies mostly they used to have the latitude longitude in the table itself. So maybe, yeah, if you are willing to go in that direction, just ping me. I'll just try to see what I can do.
Definitely, I will contact you and we will do together also if you are like
Yeah, yeah. Just
available.
to follow what Mr. Nitin has just told, just like a railway schedule or even for a bus schedule, you used to have that from and to location, right? The starting point, or sorry, starting time, and it will reach the destination. So we can just geocode those locations as well as the intermittent stops. It will give a rough idea like how much time it will take. So we have to get
Okay,
hold of that schedule. That's what I think he meant. Just so you can also maybe think along those lines.
okay. Definitely, I will look this also.
Thank
Yeah,
you. Thank
great feedback. And I'm looking forward to a next case study from both of you together.
Yes,
Uh,
definitely will.
I have a question.
Yeah.
Yeah, I'm Divyanshu from IIT Indore. I actually joined a bit late, so maybe you have mentioned it already. And I'm outside of the campus, so you may listen a bit noise from the outside surroundings. So my question is, while calculating the travel time, does the topography affect the calculation or the findings?
Yeah, topography related. I have also do work on Himachal that is published in the journal also, but we have to also see the topography things. That is the difficult things, not the difficult, but we need to incorporate in the another way or the different methodology as per the IPHS norms. Also, they have to also categorize. Is that the topography area, or is that the rural area, or the plain area, or is that the urban area or the rural area? That thing is also categorized as per the IPHS norms. So we need to also see in that context also. But this is
Okay,
also possible in
yeah,
that area also,
thank
topography
you.
area.
One more small query. While considering the health facility, did you consider the recently launched policy by the government? Like there are health care facilities, small health care clinic kind of in each villages. It is, I think, called Arogya something. If I'm
Yeah,
correct.
yeah. But they are also doing the same work such as the sub center or the PHCs are doing.
Yeah.
Name is changed by the government. Those who are newly establishing or those who are working re-infrastructure and all these things, they have to give a new name. That is the Arogya Setu
Yes.
or
Yeah. ROG.
yeah, Arogya. But these are also working the same like sub center or the PHC is working.
Okay. Thank you, Dr. Vijay.
Yeah.
There is one question in the chat. Have you tried to link health infra into hierarchy? Like if one wants to travel from one facility to other, what will be the best route? Not necessarily the fastest one.
Yeah, I have done in my thesis this thing. Then also mention in the case study also, though from the primary to tertiary they need to more time, and from the secondary to tertiary they need to less time. But this is also very difficult in the periphery area. Those who are living in the periphery or the border area, they are not able to reach the healthcare facility on the specific time period. In the emergency or the referral system, they are facing lot of the problems, that road connectivity and all these things.
All right, I think that's all the questions we had. Thanks, Vijay. That was quite
Yeah, thank
interesting.
you so much.
And it's good to see the network analysis. I have a story that I tell people that I did my master's thesis in year 2004, which was on network analysis. And I used ArcInfo and Esri products. And for the longest time, after I started using QGIS, I wished I could do the same with open source. And in 2015, once all this new network analysis tools were launched, I re-implemented my master's thesis in QGIS, and it worked. So I think a lot of people still don't know that they can do this with open source. So I think your case study was a great example for people to show that this is possible.
Yeah, thank you so much. Thanks to all.
If you'd like to give a talk in our next month's meeting, we have a speaker registration form available. It was sent to the mailing list as well. So if you know a good speaker, you can send them. If you want to talk about anything, I think it should be even a small thing that you say, hey, I found this really cool way to visualize data, or I found this plugin that was interesting. So even a short lightning talk would be good. Or if you want to give a more detailed talk, I think everybody who's here has done some cool work in QGIS. So if you want to give a talk, fill out the form or just reach out to me directly, and we'll be happy to host you in the next meeting. We have 5 more minutes. Any other questions or discussion thing about the user group or in general?
So I want to suggest. I don't know what is how much that feasible or not. Can we start after or that in future mentor like those who are facing the using that the QGIS or the lot of the problems in the student time period? Maybe that we can like start to that mentor from that our side and just like a do that these are the students and who is the mentor, who is the mentee, like that.
Yeah, I think that's a good idea. Typically, how like we had this Telegram group, which was meant for this kind of help. Like you can ask for help. We have few people asking questions. So for technical help, I think it'll be good because we have a lot of expertise in this user group. So we can set up something more formal as well, where people who have time and inclination, we can list them on the website as experts, and people can say, "Hey, I need some help," and they can reach out. So
Because I have already working in that Amartya Sen group, SDCA capabilities approach. They have also doing same type of the things, and another lot of the public health related. Those who are working in the public healthcare, they are also doing the same. So we can also like publicize our QGIS, or those we can also those who are interested to learn, but they are not able to learn. They can shift from the another tool.
yeah, so Arvind, who's also in academia, he's also part of the user group. He's been championing this idea of establishing student chapters within each college, where with some representative from this group can engage with the college and students to help them
Yeah,
adopt
that's
open source. So he has this idea on this student chapter. So maybe I'll connect you with him since you are also interested in working on similar. He's been trying, but again, he needs all of this effort needs time and energy. So if there are more people working on it, we can do something. So yeah, good suggestion. And I think if we reach more students, that's a good time to engage more people with open source.
Yes, yes.
Yeah, Jyoti mentioned we have Google group. A lot of this thing is there's also a friction. I think, especially students, they find it sometimes hesitant to reach out to people. So I think the idea for the college group was like we reach out to them. We just open up the channel saying, "Hey, here is the expertise. If you need help, we are here." Instead of saying, "Hey, you can always write to us." And I like the idea of the mentor because nowadays people can get the answer to the questions using AI tools and ChatGPT. But is that the correct way to do it? Right? So you need a mentor with somebody with experience to say, "Hey, there are 10 ways to do it. This is the right way." Or maybe you should not do this. Focus on storytelling versus just doing your analysis. So I think having that more experienced user and opening the channel will be helpful. Right, cool, everybody. We'll see you all next month in the meeting. If anybody wants to present or publish anything on the website, please fill the forms or reach out to me directly. Well, thanks, everyone. Thanks, Jyoti. Thanks, Vijay.
Thanks, everyone. Bye.
Thank you so much. Thank you.